Welcome back to Blocking the Flame, Anakinra and COVID. I'm your host, Gaganasri, and this is episode 11, Anakinra in Pediatric COVID and MISC Special Considerations. Throughout this series, we have explored how Anakinra works in adults, but today we are shifting our focus to a particularly vulnerable group, which are children. Particularly, we'll be discussing Anakinra's role in treating pediatric COVID-19 and multisystem inflammatory syndrome, which is MISC, in children, a condition that can arise post-infection. To help us navigate this topic, we are joined by Aseema. Welcome back, Aseema.
Thank you so much for having me again, Gaganasri. It's a real pleasure to be here, especially to talk about such an important and emerging area in the pediatric care.
Absolutely, Aseema. Let's start by setting the stage for our listeners. Could you explain what MISC is and how it connects to COVID-19 in children?
Yeah, certainly. So, multisystem inflammatory syndrome in children, or MISC, is a rare but severe condition that typically occurs weeks after a child has had COVID-19. It's an immune mediated response where the body's immune system becomes overly activated, leading to inflammation in multiple organs such as the heart, lungs, kidneys, and even the GIT. And what makes MISC especially concerning is that if not treated promptly, it can result in organ failure or worse, even death. It seems to be triggered by the body's response to the SARS-CoV-2 virus even after the infection has cleared. And while most children experience quite mild COVID-19 symptoms, those who develop MISC face a much more severe and inflammatory response.
Thank you for that explanation, Aseema. It's a stark reminder of how unpredictable the immune response can be. Now, Anakinra, as we have discussed before, is an IL-1 receptor antagonist.
Mhm.
How does Anakinra fit into the treatment of MISC in pediatric patients?
Anakinra has emerged as an intriguing option for treating MISC because it targets the IL-1, which is a key cytokine that fuels the inflammatory process in this condition. In the context of MISC, IL-1 plays a significant role in driving the immune system's dysregulation, and by blocking it, Anakinra helps to reduce excessive inflammation. And what's exciting is that early reports suggest that Anakinra might be especially beneficial in severe MISC cases, particularly when other treatments like intravenous immunoglobulin or IVIG or steroids haven't fully been effective. So, by targeting this inflammation at its core, Anakinra can help reduce the symptoms and potentially shorten the recovery time for affected children.
It's like taking the reins of a runaway horse and steering the immune system back on course.
Yeah.
Now, using Anakinra in children presents some unique challenges. What are the special considerations when administering this treatment to pediatric patients?
Yeah, so you're absolutely right there, Gaganashri. The immune system in children is very different from adults. So dosing anakinra in pediatrics requires very careful attention. Children's bodies metabolize drugs very differently compared to adults. So the dosage must be carefully adjusted based on weight as well as their age. This means that close monitoring is essential to ensure the treatment's effectiveness while minimizing potential risks. And additionally, timing is really crucial here. Administering anakinra earlier in MISC cases is key to preventing organ damage. But there's still a need for more clinical data to establish the optimal window for intervention. And another concern is the risk of infection since anakinra is immunosuppressive. We need to be vigilant about secondary infections when treating pediatric patients.
That's a really important point there.
Yeah.
Timing and dosing are like walking a tightrope, ensuring you strike the right balance for optimal results.
Mhm.
Now we know IVIG and steroids are also common treatments for MISC.
Mhm.
How does Anakinra work along these therapies?
Well, anakinra actually works quite well alongside both IVIG as well as steroids. IVIG provides immune support, and steroids broadly reduce the inflammation, But Anakinra specifically targets IL-1, which is central to the inflammatory process in case of MISC. And this multi-pronged approach can be more effective in controlling the inflammation than any single treatment on its own. And in some cases, clinicians have used Anakinra in combination with IVIG as well as steroids when the disease does not respond well to the initial treatments. The early data suggests that this combination may lead to a more significant reduction in inflammation, which can improve outcomes in severe MISC cases.
So it's like orchestrating a symphony with each treatment playing its part to create a harmonious effect.
Right.
Now, we have heard that early intervention is key. Does that mean Anakinra is most effective when administered at the beginning stages of this disease, or can it still help in later stages?
Well, while early intervention is typically the best strategy to control inflammation and prevent long-term damage, Anakinra can still be effective at later stages, according to some studies, particularly if organ damage has already begun to progress. The key is to block the IL-1 pathway as soon as possible in order to prevent severe complications like cardiac dysfunction or shock. And if Anakinra is started early enough, it can help mitigate some of the most dangerous effects like heart or even kidney failure.
That makes sense. Timing really does seem to be linchpin in determining how well Anakinra can help.
Mhm.
Before we wrap up, are there any final thoughts you would like to share on Anakinra's role in pediatric COVID-19 and MISC?
Well, yeah, so I would like to add here that Anakinra holds a lot of promise in managing severe inflammation in pediatric COVID-19 cases, particularly in the case of MISC where the immune system goes haywire. And as we continue to understand immune responses in children, IL-1 inhibition might become a crucial component in preventing long-term damage. However, we still need more research to establish the best timing, dosing, and safety profile for Anakinra in case of children. But this is a truly exciting area of study with the potential to make a real impact in pediatric care.
Thank you so much, Aseema, for sharing your insights. Clear that Anakinra could be a game changer for treating pediatric MISC, but as you said, more research is needed to define its exact role. Next time on Blocking the Flame, we'll move beyond acute infection and dive into the lingering effects of long COVID. We'll explore the latest immunological theories and how chronic inflammation might be contributing to persisting symptoms. As always, this podcast is for educational purposes only. For any clinical concerns, please consult the healthcare professional. You have been listening to Blocking the Flame, Anakinra and COVID. Stay tuned for our next episode.